Hi, my name is Fernanda Garcia Perez, and I'm going to talk about summary of Ribavirin for chronic hepatitis C virus infection in transplant recipients and immunotherapy and renal cell carcinoma. The first topic is Ribavirin for chronic hepatitis C virus infection in transplant recipients. Definition: hepatitis C is a liver disease caused by infection with a virus known as hepatitis C virus. The virus has at least 4 different types: genotypes 1, 2, 3, and 4. Genotypes 1 and 2 have been found only in humans, and genotypes 3 and 4 circulate in several animals without causing any disease and occasionally infect humans.
Put to work what we have learned about hepatitis E diagnostics. Our first patient is Hannah. She feels sick and had to vomit at home. She's feverish and her skin has a yellowish color. Her symptoms started 1 week ago. 4 weeks ago, she came back from Mexico when she visited family. Obviously, we think about hepatitis. Let's order lab tests. In Hannah's lab report, we can see that her liver enzyme function is significantly elevated. Furthermore, her hepatitis E tests are positive. Hepatitis E RNA is also detectable. So what's your diagnosis? Hannah has no history of immunosuppression. So let's take a look back at the graphic dealing with immunocompetent patients. Her ALT is very high, which signifies serious liver damage. Anti-HEV IgM and IgG are both positive, and we could detect RNA in Hannah's stool. Based on these results, we can conclude that Hannah is most likely in the early phase after infection. So Hannah is suffering from an acute hepatitis E infection. Let's see our next patient. Our second patient is Pete. He suffers from abdominal pain of recent onset. In the lab report, we can already see elevated liver enzymes. Pete received a lung transplant 8 years ago. Currently, he is on immunosuppressive therapy. Furthermore, he tells us that he's a passionate hunter. Based on Pete's history, we include hepatitis E screening in our lab report. We can see that his liver enzyme function is significantly elevated. His anti-HEV antibodies are negative. However, the lab detected HEV RNA in Pete's stool. What does that mean? Since we know that Pete is taking immunosuppressive medication, we should consider this in interpreting his lab results. We know that immunocompromised patients can have problems producing antibodies to the virus. So in Pete's case, it is essential to measure RNA. His lab report shows elevated ALT levels as a sign of liver damage, but negative antibody tests. However, there is RNA detectable in his stool. Pete is suffering from an active, ongoing HEV infection. Based on the laboratory findings, we cannot determine when Pete was infected. It may have been recently or more than 6 months ago. However, it is not important to know that. What is important is that Pete gets appropriate treatment and follow-ups. Congratulations! Now you can handle hepatitis E lab results.
Hepatitis E is RNA virus, spread by the fecal-oral route. Incubation period 3 to 8 weeks. Common in Central and Southeast Asia, North and West Africa, and in Mexico. Causes a similar disease to hepatitis A, but carries a significant mortality, about 20% during pregnancy. In general, hepatitis E is a self-limiting viral infection followed by recovery. Prolonged uremia or fecal shedding are unusual. In acute infection, IgM antibodies to hepatitis E virus are positive. Does not usually cause chronic disease. A vaccine is currently in development, but is not yet in widespread use. Thank you for watching. For more
Applications in medicine. The hepatitis E virus is transmitted mainly through the fecal-oral route due to fecal contamination of drinking water. This route accounts for a very large proportion of clinical cause with this disease. The risk factors for hepatitis C are related to pure sanitation, allowing virus excreted in the faces of infected people to reach drinking water supplies.
Hey, thank you for watching Medicosis Perfectionalis. Hepatitis E pneumonic. The E pneumonic, also known as the EU pneumonic, coming up. Hepatitis E, remember EU. It causes jaundice in the Far East, Egypt, and by Egypt I mean Africa. And by the way, Egypt is my home country. India, Central America, contaminated water, contaminated is undercooked seafood. Sometimes some genotypes of Hep E are endemic in the swine. So undercooked pork can cause E hepatitis. So swine, pigs eat everything, including garbage and worms. So that's ew. No offense to pigs. Fecal-oral route of transmission. Sometimes it's common in pregnancy. And when it comes to pregnant women, it's fulminant. Fulminant means massive necrosis, which can lead to failure. Ew. And there is marked cholestasis in hepatitis E. Mostly it's acute. In these countries, sometimes it's the most common cause of acute viral hepatitis. Wow. But, however, it also can be chronic, such as patient with HIV or patient with immunosuppression. Some textbooks, including Harrison's, which is my favorite book, I will link it in the description, it regards Hep E as an opportunistic infection for people with HIV. So, acute will have IgM antibodies in the blood, and chronic will have anti-HEV IgG. It's very similar to Hep A on electron microscopy. To remember that A and E are both vowels.
Pros and cons. In rare case, acute hepatitis C can be severe and result in fulminant hepatitis, acute liver failure. These patients are at risk of death. Fulminant hepatitis C occurs more frequently when hepatitis C occurs during pregnancy.
Hepatitis E virus, referred to as HEV, is a common cause of sporadic and epidemic acute liver disease in developing countries. In the United States, sporadic cases of both imported and locally acquired HEV infections are mostly seen among adults. Incubation ranges from 15 to 60 days following exposure, with an average of 40 days. Liver enzyme elevation, as shown in blue and labeled ALT for alanine aminotransferase, usually occurs 4 to 5 weeks after exposure to HEV and persists for 3 to 13 weeks. Symptoms noted by the purple bar occur when liver enzymes are elevated. Virus excretion in stool, illustrated by the orange bar, is variable, but usually lasts from about 1 week before symptoms appear until about 1 week after they have surfaced. However, this time frame can be longer in some people. Viremia in acute self-limited infections, shown by the green bar, can be detected about 3 weeks following exposure, or a week or so prior to onset of symptoms, and lasts for about 2 weeks. Antibodies to HEV, both IgM anti-HEV, depicted by the pink hatch line, and IgG anti-HEV, illustrated by the black hatch line, are usually positive about 3 to 4 weeks after exposure. IgG anti-HEV persists, but IgM anti-HEV declines rapidly during early convalescence and is usually negative by 13 weeks. HEV serologic testing in persons with acute hepatitis, for which other causes have been ruled out, may be performed, especially in someone who has recently traveled to an area where HEV infection is more common. Chronic HEV infection is rare, but has been increasingly recognized in immune-compromised patients. Immunoassays to detect anti-HEV are commercially available, but are not FDA approved. Nucleic acid tests for the detection of HEV RNA are performed in research labs, but are not commercially available. This segment is now complete.
Use of bleeding in Ecuador. Every year, there are estimated 20 million HEV infections worldwide, leading to an estimated 3.3 million symptomatic cases of hepatitis E.
There are various causes of hepatitis, but today we are looking at an infectious one called hepatitis E and how it can affect you. Did you know that your liver is the heaviest organ in your body? It does several important jobs, including cleaning your blood and producing a liquid called bile, which helps digest your food. It's important to keep your liver healthy, which is why you want to avoid hepatitis, a term that is used to describe inflammation of the liver. The hepatitis E virus, known as HEV for short, can cause infection through several routes. One of these is by eating undercooked pork, wild boar meat, or pork products. Although HEV can be present in animals such as pigs, it does not normally make them ill. When it infects humans, the symptoms of HEV infection are usually mild and clear up in a few weeks. However, the disease can, in rare cases, cause serious health problems and even death. The good news is that you can reduce the risk of HEV by following a few simple steps. When cooking whole cuts of pork, wild boar meat, pork products and offal such as kidneys, make sure that the meat is thoroughly cooked and not pink when you cut into the thickest part, that it is steaming hot all the way through and any juices run clear. Practicing good hygiene is also important. Wash your hands thoroughly before preparing or eating food and after using the toilet. Always remember to clean surfaces properly and chill food at the correct temperature. Handle it carefully so it doesn't cross-contaminate other foods or surfaces. So there you have it. FSA explains hepatitis E. To find out more, visit food.gov.uk.
In conclusion, Ribavirin as monotherapy may be effective in treating a chronic HEV infection. 3 months course seems to be an appropriate duration for this therapy, though a longer therapy can be given to those who still have viremia 1 month after the initiation of therapy. The two topic is immunotherapy and renal cell carcinoma. Definition: immunotherapy is the use of drugs to boost a person's immune system so that it recognizes and kills cancer cells more effectively. Several types of immunotherapy can be used to treat kidney cancer.
So the next wave is these checkpoint inhibitors. There's probably at least 4 or 5 trials that I know of. I think only one with atezolizumab that's actually up and running. Others with nivolumab and durvalumab, and also, I mean, any drug you can imagine will be tested in that setting. It probably makes a lot more sense. It's going to be better tolerated for patients, I think. I think probably has the potential to extend overall survival, which would be ideal, which we haven't done to date, even with S-Track. And so we'll have those results in many years, but I think probably if we're sitting here in 5 to 10 years, we'll be talking about those drugs as standard of care.
Applications in medicine. Avelumab Bavencio is a drug that targets PD-L1, a protein related to PD-1 found in some tumor cells and immune cells. By blocking PD-L1, it can help stimulate the immune response against cancer cells. This can often shrink or slow the growth of some tumors.
I think it's a truly exciting time. I mean, bladder cancer has been pretty much neglected for decades. We only had cytotoxic chemotherapy that had some modest efficacy, I would say, in patients, and now we are witnessing a true revolution with the approval of 5 immunotherapies. We're still, I think, working our way through in how to best identify patients who may benefit from these therapies and how to improve these therapies. But I think we are witnessing very durable responses in a subset of patients who can benefit from these therapies for years with really sometimes minimal side effects. I think this is truly gratifying for any medical oncologist. So kidney cancer has always been kind of like a immune responsive tumor. It's really the only other cancer where we have essentially old-fashioned immunotherapy a la high-dose interleukin-2, similar to what we use in melanoma, approved with long-term benefits. So since November 2015, we have nivolumab approved, a PD-1 inhibitor, and we do know that we can induce very durable responses in a small subset of patients, around 21% of patients. However, simply speaking, it's not enough. And I think the future is going to be to look at combination therapies. This will come forward in the short term, I would say, in 2 different flavors. One is the combination with VEGF inhibitors, and the other one in combination with another immune checkpoint inhibitor called CTLA-4 inhibitor, or Yervoy. And I think we will witness in a very short amount of time how the first-line therapy for kidney cancer is going to be transformed.
Pros and cons. Immunotherapy is the use of drugs to boost the immune system, but some more common side effects of combining avelumab with axitinib are tiredness, diarrhea, high blood pressure, skin rash or blisters, cough, shortness of breath, or abdominal pain. See below for information on the possible serious side effects of all checkpoint inhibitors.
Today we're working on good news, and I like that. Good news is always fun.
Meet 72-year-old Larry Carlson. His joyful laugh and spunky personality will bring a smile to anyone's face. But the last 3 years haven't been so jolly.
I had a rather large cancer starting in my left kidney.
In November of 2014, Larry was diagnosed with stage 4 clear cell renal cell carcinoma.
I was then working with another hospital, and they were going to set up the surgery to do this. I really wasn't comfortable necessarily with the way that was going.
Which prompted Larry to look for care elsewhere. And he found himself here at UT Southwestern and underwent surgery with Dr. Vitaly Margulis and Dr. Adam Yop.
I trusted UT Southwestern. They have the people here. I had what they call the Whipple. That involved
approximately 9 hours on the table, 5 blood transfusions, and as a result of that, my left kidney was out, my spleen came out, I think it was 22 to 28% of my liver was taken out, and they had what they call the pancreas tail cleaning.
However, a year after undergoing surgery, doctors found the cancer was back and continued to grow.
It blew up in my right shoulder, and I had a rather substantial sized tumor.
That tumor, combined with another one the size of a walnut, located in his lungs and under his diaphragm, led oncologists Dr. Jim Brugarolas and Dr. Hans Hammers to suggest Larry try a new clinical trial involving immunotherapy called RADVAX.
Dr. B said, when I first met you, you said you'd try anything that we came up with to fight this cancer. He said, we're going to have a clinical trial for people that have clear cell, renal cell cancer that's metastasizing. And he said, you meet all that criteria. Opdivo and ipilimumab, you get those 2 treatments together.
The idea is to radiate 1 or 2 tumor sites with kidney cancer and destroy the tumors and create really a vaccine inside the patient, and then take 2 drugs that take off the brakes of the immune system and then activate the immune response.
The trial was funded by Brenda and Ralph Knapp, a couple involved in UT Southwestern's kidney cancer program, who raised over $300,000 with the help from their community.
Hydroplating in Ecuador. The data presented show that patients receiving immunotherapy can better cope with their daily life without being so conditional by side effects. And then the benefit is 44% greater than those who do not receive immunotherapy in Ecuador.
For papillary cancer, for renal cell carcinoma, so there are 2 types. One is papillary type 1, the other one is called type 2. So type 1 actually has a higher frequency of a gene mutation. It's called MET mutation. So Dr. Shrari actually did a clinical trial with a MET inhibitor that showed some modest activity, but that c-MET inhibitor, according to his talk today, it's not a very pure inhibitor. So right now, I think they are planning to do another more pure MET inhibitor, and then hopefully, this new MET inhibitor can have more clinical activity in this type of cancer. So right now, we are still relying on drugs that are for the common clear cell carcinoma to treat these rare types of tumor. But clearly, they have different drivers of gene mutation for this rare type of kidney cancer. So by using one class drug on another class or other classes of tumors, that may
In conclusion, kidney cancer remains one of the most common tumors worldwide, causing more than 140,000 deaths a year worldwide, and renal cell carcinoma accounts for 90% of all cases. But thanks to medical advance, achieving a better life through the immunotherapy procedures has been and is a great achievement worldwide for medicine and people.
Renal cell carcinoma is the most common type of kidney cancer in adults. It accounts for approximately 3% of adult cancers, and the incidence has risen steadily by about 2 to 4% each year in the past few decades. It is effectively a collection of different types of tumors, each derived from the various parts of the kidney cell and displaying salient genetic characteristics, histological features, and, to some extent, clinical picture. When it metastasizes, it has the tendency to spread to the lymph nodes, lungs, liver, adrenal glands, brain, or bones. While the exact cause of renal cell carcinoma is unknown, there are risk factors that increase the chance of developing it, such as smoking, high blood pressure, family history of kidney cancer, and obesity. The chance of developing renal cell carcinoma increases with the age, and males have double